The following segment is sponsored by Moda Health.
Thanks so much for watching Afternoon Live. It's open enrollment time for choosing a Medicare plan. And here to offer guidance, we welcome back from Moda Health, Senior Medical Director Dr. Jim Rickards is with us, as well as the Vice President of Customer Service, Margaret Thornburg is here. Welcome back, you two.
Thank you.
Thank you.
Well, 'tis the season for everybody saying open enrollment, but a lot of people don't really know what's going on or what has changed. So Margaret, can you share a little bit about why this is so important?
Yes. What's changed this year is that Medicare has revamped their website and made it much easier for members to review plans and compare plans on Medicare Plan Finder. They've gotten rid of a lot of the words and got more graphics, and they also have a chat feature.
Really?
Yeah.
Oh, that's really good, because my mom often calls me, or my brother, and is like, I don't understand, there's so many things here. But visually, if it's changed that way, I'm sure it'll be a little bit more accessible for her to move around, right?
Right, and it's easier to find what's different between the plans. So another thing that's changed this year is a lot of plans have added extra benefits. Things like transportation to medical appointments, and also dental care.
Really?
So it's really easy to compare plans on this new Plan Finder.
Wow, that's really cool. Okay, so now, Dr. Rickards, tell me, what should people do or know before they really start digging in here and looking for a plan?
Yeah, well, I think when you're selecting a plan, it's important to think about all your healthcare needs beyond just your medical needs. So your medical needs, of course, are incredibly important. Is the doctor you're currently seeing or you want to see covered? Are the medications you're taking, especially to manage a chronic condition like high blood pressure, covered in the plan's formulary? But think beyond that. You know, as we age and our bodies change, we have additional needs, such as vision needs. So are eye exams covered? Are eyeglasses covered? Is there a hearing benefit? Can you get a hearing test or a hearing aid? Or as Margaret alluded to, you know, are there some more lifestyle benefits? Is there a fitness type plan that's offered with it as well?
Right, there's a whole lot to think about.
Yeah.
So then, Margaret, if you had to pick 5 things, just 5, that people really need to remember when they're selecting their plans, what would they be?
Well, I think Dr. Rickards hit on a couple of the big ones. You need to look and see if your provider is in the network in the plan you're looking at. It's really important, if you already have a relationship with your doctor, that doctor is part of the plan.
Right.
Another thing to think about is your lifestyle in terms of travel. So some plans have different kinds of benefits for in a certain area or outside if you're traveling. So it's important to know, are you going to travel? Another thing to think about are the services that you get all the time. Maybe you need blood pressure check or things like that. How is that covered under the plan? Is there a copay? You know, maybe look at whether vaccines are covered at zero copay. So what are the things that you use most, and how are those covered under the plan? The drugs, your pharmacy, is your pharmacy in the plan, and are your drugs covered, and at what price?
Man, that's a lot to think about. But it's true, because I think about that too. You know, you're like, oh yeah, this just looks good. And then you get in there and then you realize a lot of the things that you're used to are not covered anymore. That's not okay.
No.
That's not good. That's not good. Okay, so now where should people go then? Where would you suggest, Dr. Rickards, people go?
Well, we'll share a number of resources here at the end, but modahealth.com/Medicare is a great place to find some more information. You can also go to medicare.gov. They have a great website. Either of those resources also offer the ability to call to get additional help over the phone. The state also has some resources available where you can even schedule an in-person consultation with someone to talk about the different options, and we'll show that up here as well.
See, that's what my mom likes.
Yeah.
She likes the in-person, you know, talk to somebody, see somebody, have somebody break it all the way down, and that somebody can't be me all the time, because I'm not exactly sure, but maybe I'll go with her so that we can understand it together.
Yeah.
Now, the period of time, it's really important to take care of your business during the open enrollment, because after that, are you just completely shut down for it the next year, pretty much?
Yeah, so open enrollment is going on now. It's important that you use those resources and look at what you need, like we talked about, because open enrollment is not a year-long process.
That's right, it's open now. Thank you guys so much.
Thank you.
This has been really helpful. We're going to have more information about Medicare in today's Moda Health Minute segment on our website at KHU.com, and you can also go to modahealthminute.com for more. We'll be right back.